Hello, guys. How are you? How have you been? Welcome to today's session. My name is Dr. Ryan. Today, we are going to talk about depression, a subject that has not been discussed by many before. It's not been tackled by many people before because it seems difficult. But then I'm going to simplify it for you just to make sure that you take home some points. So, what is depression? I'll start by definition. Depression is a mood disorder that causes a persistent feeling of sadness or a sad feeling and loss of interest in doing most of your daily activities, and it can actually affect one's capacity to function. So, surprisingly, two-thirds of people who have depression don't know that they have a treatable illness, and therefore they don't seek professional help. This means that it means that they don't go to hospital, they don't go to healthcare facilities, they're just staying at home. And this is actually mainly due to the public perception of this particular condition. Because most people think that when you're smiling, you are okay. When you're doing your normal things and just sadness here and there, you are okay. So these people are not going to hospital. They'll only go to hospital when they get other somatic symptoms, bodily symptoms, like headache, abdominal distress, fatigue, or just feeling irritated is when they'll go to hospital, and then a diagnosis of depression will be made. So this condition affects all the ages, but then mainly starts at the age of 12. More severe between the age of 40 to 59. And actually, the disease is more severe again in women more than men. Genetics come into play, gender, sex is coming into play. So let's go to the American Psychiatric Association, DSM-5. What is exactly saying about depression? Classifications have been made. So many depressive disorders are there. So I'll just give you a few. Disruptive mood dysregulation, one of them. Major depressive disorder, which has a depressive episode, another one. We go to persistent depressive disorder, which is called dyspnea. Leave it. We go to premenstrual dysphoric disorder. Still in that classification. We have a depressive disorder due to an identifiable medical condition. That's another one, or medical illness. And then we also have other specifiers like depression that is coming during the peripartum. Depressive symptoms that are coming during the peripartum period, before you deliver, after you deliver. We also have other mood congruent and incongruent features, melancholic features, and catatonia. This is all to do with the APA, but then we are not going to go deep into what APA says about depression because it's very deep and then it needs another entire discussion. So what is the etiology really of depression, and which factors come into play? Etiology not known, the cause not known, but then we have genetics coming into play and environmental factors. Genetics, depression has a genetic component. For example, like in identical twins, when one of them gets depression, there's a likelihood three times probability of the other one getting depression as compared to the general population. Environmental factors are neither here nor there, but then we have some specific stresses. For example, we have someone who loses their parents below the age of 10, they are more likely to get depression than someone who will lose their parents later on in life, like past 30 years. We also have others like chronic pain, chronic medical condition or medical illness will cause you depression. Psychosocial stress, and this one has so many other components like impaired social support, caregiver burden, bereavement when one loses their loved one, negative life effects also come into play. Loneliness in life can also cause depression. So what are the signs and symptoms? Most people actually who have depression have just normal appearance. They are just appearing normally to the general population. They don't look like they are not okay. But then with more severe disease, then we have now change in grooming, change in hygiene, and change in weight. Weight can be either low or high, because some people who have depression are eating more than their normal, the way they eat normally. Others don't eat at all, so the weight can either go low or go down. So let's look at now the MDD, the major depressive disorder. It will present for a period of more than 2 weeks, 2 or more weeks, with either five of the following symptoms. 1, a depressed mood. 2, diminished interest or lack of interest in and pleasure in normal daily activities. 3, sleep disturbance. Either you're sleeping too much or not sleeping at all. Hypersomnia or insomnia. 4, psychomotor agitation. 5, fatigue or loss of energy. 6, you have a feeling of worthlessness. You feel like in your circle or in your community that you are not important anymore and you don't matter. 7, diminished ability to think. You cannot make a decision. You are indecisive. You are trying to make a decision, but then you don't have a stand really. 8, you have suicidal ideation. You are thinking about death, or you are having suicidal thoughts, or actually you have attempted to commit suicide. Either you are having a suicidal ideation without any plan to execute the suicide, or you have actually attempted to commit suicide. So those are the 8, 5 of those. But then in these 5, depressive mood must be there for you to diagnose depression, and it's over a period of more than 2 weeks. So now I'll go very fast into the differential diagnosis. Conditions that present the same as depression, with symptoms that are similar to depression. CNS, central nervous system disease or conditions like Parkinson's disease, multiple sclerosis. We have like CNS neoplasms, or even malignant conditions of the central nervous system. We also have endocrine, that is hormonal. Hyper and hypothyroidism have been implicated. We have drug related. This is either drugs of abuse like cocaine, or side effects of prescribed drugs like some antihypertensives like methyl dopa, cause symptoms that are just like the depression symptoms. Then we also have other classes, appetite suppressants, muscle relaxants. They would also cause symptoms that are just like the symptoms for depression. Other conditions, we have infectious diseases like mononucleosis. We also have sleep disorders. All these are differential diagnosis. So in the workup, when you talk about investigations into depression, we mainly do lab workups to rule out the differential diagnosis that I've just mentioned. So we'll do labs for the thyroid, we'll do labs for all the others, basically for infections in the body and all. We can also specifically do neuroimaging, imaging of the brain to identify a cause. When we go to the management is neither here nor there, but then we have antidepressants taken over a period of between 2 to 12 weeks or even longer. And we have so many classes of antidepressants. This is pharmacotherapy. We have so many classes. We have the selective serotonin reuptake inhibitors. We have the monoamine oxidase inhibitors. We have the tricyclic antidepressants. So it's upon your healthcare provider to identify which one is good for you, or which one can control your symptoms, and which one will be able to manage your condition. We also have, from the pharmacotherapy, we have also the psychotherapy. Psychotherapy is actually now like being helped but not taking drugs. We have components like cognitive behavior therapy. You also have mood behavior therapy, the emotion, like giving you an emotional support. We have so many, so many components of this: emotion based, interpersonal psychotherapy, CBT. Then you also go to ECT, is the third one. ECT is electroconvulsive therapy. This actually is indicated for people who have failed on medical treatment. They have also failed on the psychotherapy, and it's actually been shown to have, like, the improvement of symptoms is better with ECT for people who have failed on the previous two, and it's indicated also for people who have shown improvement on ECT before. So electroconvulsive therapy is a good one, and for resistance, it is usually taken in. We also have others like bright light therapy, just taking someone outside to somewhere where there's a bright light, like daily sessions, and all these things, all these managements have their own timing. So it's upon you to consult, if you present with symptoms of depression, to consult with your healthcare provider so that they decide on the period you are going to be on this medicine, the period that you are going to be on the treatment, whether psychotherapy or ECT or bright light. And like I said, for people who are resistant on one or two, combination is the best. You can combine. You can combine psychotherapy with ECT with pharmacotherapy, like that. But consult with your healthcare provider. Then the other component, of course, is something that is neither here nor there. We have pediatric depression, we have peripartum, but I'm not going to discuss about them. What is there is that if you present with features that are consistent with depression, and it's just during your peripartum period, please make sure you consult with your healthcare provider. And again, most of the medication that are used for depression are actually well tolerated by mothers who are breastfeeding and their babies. So don't feel like I'm going to wait until my baby grows or this and this. Just seek help from your healthcare provider, and they're going to make a plan for you. So this is something simple about depression. I know, we are laughing, we are smiling, we are talking with our friends, really not knowing about what they are going through. But if you identify anything, even in your friend, note it, discuss it with them, discuss it in a way that they'll be able to accept, to be involved in the discussion, and then maybe they can take action, they can seek help from a professional, and I know they'll be helped. So this is all about depression for today. If you have questions, please go down to the comment section again, ask the questions. I'm going to research about them. I am not the custodian of all knowledge. We also do research. We also do, base our discussions on what we've been taught in school in the years past. So feel free, let's interact, and let's do something that can help the community. Again, if you have any symptom, seek help from your nearest or from your available healthcare provider. We are still having COVID. We are still in the middle of a pandemic. So, as I leave today, please keep safe and stay away from this menace. Put on your mask, wash your hands, keep that social distance when you're in public places, and always take care. I wish you all the best, and see you next week. I'll be waiting for you here. Thank you very much.